I'd like you to imagine for a minute if when you went to your GP, the first question they asked you was, what is it that makes you happy, rather than what is it that I can do for you today? How can I make you better? And that's what social prescribing does. We know that being happy makes us healthier, but our public services aren't designed to make us happier, they're designed to fix us. Surely if we were happier, our public services wouldn't need to fix us, and they could spend a lot more time preventing bad things from happening and intervening when things go wrong. So what I'd like to do today is talk to you about the social prescribing and how you can maximise the social value that it creates. And by that I mean creating happier, healthier people, but also more effective and efficient public services. So what is social prescribing? It's really quite a simple concept. It's about giving GPs the opportunity to link patients with complex health conditions to a range of different opportunities in their community. It's about kind of empowering that GP to do that. So how does it work? It's really quite simple. You have a link worker that gets placed in a GP practice that takes a referral from a GP, a mental health practitioner or a nurse maybe, and they take that patient and they spend some time with them. They ask them what is it that they want and they need, what are the activities that they can do to help them develop, and then how can they support them to engage in their activity, in their community. In the really best examples, you get public sector funding to do this, and you also get public sector funding to build the capacity of a local voluntary sector ecosystem that can meet the needs of those organisations. Now, social prescribing's really taken off in the last 5 years, and the cynical amongst us might think it's because it's about austerity, it's about reducing pressure on a public service system that's creaking. We've got an ageing and ailing population, and it's about how do we kind of get around all those problems. But there's also a positive thing about social prescribing, and it's really the people that really embrace it. They're embracing it because they see the social value that it can create. Social value is a defining feature of any social innovation. I think social prescribing is a really good example of a social innovation. So what do we mean by this? Social value, social innovation, it's quite a woolly concept. It's quite hard to pin down, but I really like this quote. It's about novel solutions to social problems that are more effective, efficient, sustainable or just, and for which the value created accrues not just to society as a whole, not just to private individuals, I should say, but to society as a whole. So it's about more than just profit, wealth or economic growth. It's about creating happy and healthy people engaged in their communities. So how do we understand the social value of social prescribing? From our research, we know social value accrues to 3 different groups. It accrues to patients, it accrues to public services, and it accrues to civil society. Patients benefit from an improvement in their well-being, in their physical health, and they get kind of levels of social capital they didn't have before. Public services are benefiting because they see reduced demand from those frequent flyers in primary and secondary care, the people that go to their GP and visit A&E not because they've got a serious medical condition, but they've got nowhere else to go. They're socially isolated, they've got really low levels of well-being, and we see them using public services a lot less. And then for civil society, it's about embedding the voluntary and community sector in health and social care services in a way that enables them to leverage resources. They get funding, they get volunteers, and they can add value to the health and social care system. When we dig deeper into the social value of social prescribing, we realise that actually there's certain groups that benefit even more in terms of patients, public services and civil society. For patients, it's those whose well-being is really low. They're the ones that benefit most. But we also see those patients who kind of sustain their community engagement. They don't just take their initial social prescription and then move on. They continue being engaged in their community. They get involved in volunteering and social action. They're the ones that really benefit. In public services, we think there's real tangible benefits to primary care, but we're less convinced about the benefits to secondary care. We're seeing GPs benefit on the ground with fewer appointments from these kind of frequent flyers, but secondary care is a lot more difficult to evidence. When sick people are sick, they go to hospital, and it's much harder to keep them out of hospital, but we think we can keep them out of the GP practices. And then for civil society, what we see is it's those really small local community organisations, the ones that are really embedded in their community. Without something like social prescribing, they can't get involved in public service delivery. They can't kind of support the strategic priorities of the health service, but through social prescribing and through small pots of money that it gives them, they're able to do that, and they're able to do it in a way that adds value to their community. So we've got a really robust evidence base, I think, around social prescribing that's developing. But what I'd like to do now is kind of share with you some of the stories of people that have been through social prescribing, people that have really benefited. So I think what that does is it brings to life that social value that we're talking about. So the first story I've got is Louise. Now, before social prescribing, she had degenerative spinal disease, and we're not going to fix that. But she was in pain a lot of the time. She was really struggling. That gave her anxiety, low confidence, really poor well-being. She wasn't going out. She was relying on her family to do her shopping. She couldn't do those day-to-day tasks outside of the house. But, and this is really important, she really wanted to be independent again. She wanted a way of getting out and becoming more independent. So what social prescribing did was really quite simple for Louise, and this is a recurring theme. It's about doing simple things. She was supported to attend a local craft group, and then she was helped to create a Facebook page to sell her crafts that she made at that craft group. That's it. That's all it did. A few months later, kind of the change was enormous. So she was attending the craft group independently. She didn't need any help to go to that craft group anymore. She was doing it on her own. Not just that, she was sitting there and she was teaching younger members of the group to crochet. She was getting involved socially. And she was selling her crafts at local craft fairs. So she was getting out, acting independently, and even kind of creating a small economic impact there. And as a result of all that, she's feeling much more confident and independent. She's visiting her GP less. My next story is Gordon. And again, before social prescribing, Gordon had really severe mobility problems. He was dependent on his wife and carers for day-to-day tasks, really simple things. He couldn't get out of the house and do stuff. He had limited social contact as a result. He wasn't kind of engaging with people, with his peers, engaging in the wider community. But, again, he was motivated. What Gordon had was a really keen interest in practical activities. He liked using his hands, he liked doing woodwork and metalwork, and he wanted an opportunity to do that in the community. So again, what social prescribing did for Gordon was really quite simple. They supported him to attend a men in sheds group, as Mark was talking about earlier. He had someone at the last TEDx came and talked to you about that. But at the same time, his wife was supported to attend a complementary therapy group because that's what she wanted. So again, quite simple things. A few months later, again, a really kind of miraculous change had occurred. Gordon was now one of the group's most active volunteers. He was staying late to sweep up and tidy up after the men in shed sessions. His wife was getting much needed respite because when Gordon was at the men in shed, she was getting a complementary therapy. And as a result, they both feel a lot happier and healthier, and their marriage is a lot stronger as a result as well. And that kind of caring relationship they've got is potentially more sustainable for the longer term. My final social prescribing story is Sarah. Now, before social prescribing, Sarah had a range of multiple and complex health conditions, too many to list here, really. And as a result, she was feeling socially isolated. She was stuck in the house. She couldn't get out. She didn't know what to do. But, again, she had that motivation. She really wanted to engage in new social activities and just needed someone to help her kind of get out and do that. And once again, what social prescribing did for Sarah was really, really simple. All they did was supported her to attend a community exercise group and a local art and craft group that she wouldn't have been able to attend on her own. Again, a few months later, we see some really incredible change for Sarah in her life. She'd set up her own community arts and craft group, so she was doing independent things. They've now got a core of volunteers, so there's kind of like a new group has formed. And not just that, they've actually received their first grant. So kind of from a small kind of her being referred on to a local group, she's gone on, she's been inspired to do her own things, and that's now kind of inspired additional social action. So 3 really, really strong stories there. But what we also do is we make sure we capture that GP perspective, because ultimately it's the GPs that pay for social prescribing, so they need to be convinced that it's worth doing. This Wordle you can see on the screen now, it's what we did was we put a report we'd just done for GPs into that Wordle just to see what is it the GPs are telling us and how can we kind of visualise that. And as you can see, 3 words I think really stand out quite strongly: support, social and care. And that's what GPs tell us. They say, without social prescribing, we can't give them that social support. We can't access that kind of additional low-level social care that they really need. So they can prescribe medical things, but what they really need is some social support. And all the GPs you speak to on the ground, they're universally positive about social prescribing. Many were quite sceptical at first. They had that kind of medical model in their mind. But as soon as they saw the benefits in the surgery themselves, they embraced it, and now they're referring many, many patients to social prescribing. But we also recognise that we've still got a long way to go. There's people that need convincing that social prescribing is the right thing to do. It's happening in lots of communities all around the country, but we need it in every community. And one thing we need to do is improve the evidence base, because we're working in a health system that really values a particular type of evidence. And unfortunately, that means health economics, it means randomised control trials, it means natural experiments, it means the types of things that small voluntary organisations haven't got the skills and capacity to do. But I do think we do need better data analysis. But we also need shared and common measurement. If we've got all these different social prescribing projects, they're all measuring their impact in different ways. If we could get them all measuring their impact in a similar way, we could start comparing and contrasting what works best for who and in what circumstances, and we get a much better idea about what all of those different locally developed models work, how they work, and who they're benefiting. But also, this is really important, we need to continue capturing the powerful stories, because what our research has also showed is it's those powerful stories that really win the day. When you get GPs in a room deciding about what it is that they're going to commission in terms of the services, they share the stories about social prescribing, and they convince each other that they need to carry on funding it. So I'd like to conclude by thinking about how we maximise the social value of social prescribing. What are the things that we need to do to make sure that it really works for communities? And for me, there's three core principles here. The first one is understand, the second one is invest, and the third one is evaluate. I'd just like to finish now by telling you a little bit more about what each of those really means. So in terms of understanding, what you need to understand, really put the patients at the heart of this. What is it that local people, what types of support do they really want, and what do they need? But at the same time, you need to understand what's the capacity and capability in your community to meet those needs, and can the two things be matched up? From then, you need to think, okay, we understand what's needed. How do we invest in that? And how do we develop a model of social prescribing that works for our community? There's no good taking a model from somewhere else and saying we're going to do that here. You need to work out what is the best model of social prescribing for this community, and how can we build and sustain a local ecosystem of groups and organisations that can support us to deliver that model. Because without the two things working together, it's just not going to happen. And then finally, and I guess this is my kind of researcher's prerogative coming out here, I guess, we need to evaluate. If we're going to do this, we need to evaluate the impact of social prescribing on the priorities of key stakeholders. We also need to do that in a way that understands the full value, of the full social value that's created for those stakeholders. We need to understand what it means for the patients, what it means for civil society, what it means for GPs, what it means for the whole community. Because then if we do that, we can create a really strong case for social prescribing going forward. And it'd be really great if you could pick this up and run with it in Guernsey, but I think you've got a really unique opportunity here with the makeup of the public sector and the social makeup to do something really, really interesting and powerful. I mentioned that this talk is based on quite a lot of research, so there's some links here for you to kind of go away, read at your leisure, read in bed, read them another time of day if you want, just to kind of let you know this really is kind of based on evidence, and we want to build that evidence base. And then I'd just like to finish now by just kind of thanking you. Thank you for inviting me, and thank you for listening. And then say I'm around for the rest of the day. If you want to come and talk to me, ask questions, we can talk about how we might get social prescribing working in Guernsey. Thank you.